Welcome to Joint Session Diverse Voices in New York State Cannabis, the podcast where policymakers, legislators, thought leaders, licensees, and advocates come to discuss the evolving landscape of cannabis in New York and beyond. I'm Herb Barbot, former Director of Operations in New York's Office of Cannabis Management. Each episode, we bring you in-depth conversations with key voices shaping policy, business, and advocacy, plus expert insights on the latest developments impacting the industry. And now for the episode. Welcome to episode 19 of season 2 of Joint Session. This is Herb Barbot. In this episode, we'll speak with Gahrey Ovalle and Hugo Rivas, the president and vice president, respectively, of the Long Island Cannabis Coalition, about a recent meeting in the town of Islip, Long Island, scheduled for the purpose of voting to allow legal cannabis retail sales and the general difficulty in opening a licensed dispensary on Long Island, two counties with close to 3 million people and only 7 licensed adult-use retail dispensaries. But first, as always, let's take a spin around this week's news. Early last week, Germany's Federal Ministry of Health released a draft bill that would amend the country's medical cannabis law to impose new restrictions on the country's booming medical cannabis industry. The adult-use law that went into effect in April also removed the classification of cannabis as a narcotic, which eased the path to prescriptions for patients. However, the draft bill suggests that the path may have become a bit too easy. In a section explaining the rationale for the bill, the ministry notes that medical cannabis imports jumped 170% in 2024, but prescriptions only increased by 9%. This, they wrote, suggests that an increasing number of patients are self-paying for private prescriptions rather than obtaining it through their physician and with insurance coverage. And they are likely doing so through one of the many telemedicine platforms that have popped up in the country, which the ministry says does not amount to the same level of care as going through a primary doctor. The bill proposes 2 key changes. The first would require an in-person visit with a doctor at their office or at home in order to obtain a prescription. The second would ban mail-order cannabis. Already, industry players are pushing back. Nicholas Koperanis, the CEO of Bloomwell, which offers on its homepage a free cannabis prescription in 5 minutes, said in a statement that the premise that politicians are seriously considering slowing digital innovation in an already overburdened healthcare system, recriminalizing patients, threatening jobs, and forfeiting tax revenue is beyond absurd. Regulators in Australia flagged a similar trend of rapidly rising prescriptions offered after 2 quick consultations. The Australian Health Practitioner Regulation Agency issued guidance on unsafe medical cannabis prescribing practices. They found, for example, 8 practitioners who have issued more than 10,000 scripts in a 6-month window and 1 practitioner who appears to have issued over 17,000 scripts. This raises the very real concern that some practitioners may be putting profits over patient welfare, said Australian agency CEO Justin Untersteiner in the guidance. Back in the United States, and the continuing guessing game of will he or won't he when it comes to the rescheduling effort that was underway before the change in federal administration, last Tuesday, the House Appropriations Subcommittee on Commerce, Justice, Science, and Related Agencies passed its fiscal year 2026 spending bill with language that could block cannabis rescheduling. While the cannabis rescheduling process remains stalled, there have been mounting efforts among Trump allies and advisors to push the administration to ease how cannabis is classified. The bill now heads to the House Appropriations Committee. Despite that, another spending bill moving through Congress and already out of their respective House and U.S. Senate committees could allow Veterans Administration doctors to recommend cannabis to veterans in states where it is legal. In Pennsylvania, this past week, Democratic Representative Emily Kincaid and Republican Representative Abby Major announced the introduction of House Bill 20, which would legalize cannabis in the Keystone State. The move follows the Senate introduction of Senate Bill 120 last week. HB 20 would legalize cannabis for adults, establish the Keystone Cannabis Authority, and create the Community Opportunity Fund for social and economic equity. Other provisions would include rules for enforcement, testing, advertising, and packaging and labeling. The bill would also have clean slate language. Advocates are framing this latest effort around a potential solution for budget woes. The state needs to close a growing budget gap, Communities across the state would benefit immensely from the jobs brought by regulated cannabis, as laid out in this bipartisan piece of legislation. This includes both rural and urban communities that are getting hit hard by the lack of funding for essential state programs, from transportation to healthcare systems, as well as looming federal funding cuts. Responsible Pennsylvania spokesperson Britt Cramsey said in a statement, "Voters clearly want legalization now and cannot afford drastic tax hikes." During its meeting last Tuesday, the New Jersey Cannabis Regulatory Commission approved 4 cannabis retailers to open on-site consumption areas. This is a major milestone in New Jersey's cannabis history. These designated spaces provide consumers with safe and legal options for cannabis consumption, said CRC Chair Diana Hanawu. The clock is now ticking for New York to act with regards to on-site consumption. Back in New York, the Office of Cannabis Management announced last week that it has settled with 2 licensees following an investigation into state law and regulation violations. Charlie Fox and Basin Mixtures, Inc. engaged in prohibited cross-tier conduct, including unauthorized branding and promotion of cannabis products under a proprietary dispensary brand, the office said. They will each be required to pay a $50,000 penalty. They will also have to update internal compliance procedures and employee training and undergo 12 months of enhanced compliance monitoring, which will include unannounced inspections. The office launched its Trade Practices Bureau in February. The Bureau was established to focus on complex violations that impact the integrity of the state's legal cannabis market. These violations include, for example, inversion, the introduction of unregulated or out-of-state products into the state's regulated market, and predatory lending. This week's settlement marks a first for the new Bureau, though other investigations are ongoing. At a recent Cannabis Control Board meeting, James Rogers, the director of the Bureau, said that inversion in particular is a top priority. We do have not only a number of complaints about inversion, but we are in the middle of significant investigations into a number of inversion cases, Rogers said. We keep getting credible complaints regarding inversion, and we will continue to do the work of investigating inversion and stopping it. Thank you to Cannabis Wire for the news. Check out Cannabis Wire at cannabiswire.com. My guests today are Gahrey, Ovalle, and Hugo Rivas, President and Vice President, respectively, from the Long Island Cannabis Coalition. And to give a little history and context for our conversation, the Marijuana Regulation and Taxation Act, again enacted on March 31st, 2021, the law allowed New York State municipalities to opt out of allowing retail sales, but they had to do that by official act no later than December 31st of 2021. Now, if a town opted out, they could later opt in, but if they did not opt out by December 31st, they could not later decide to opt out. So, about half of New York's 1,520 municipalities opted out, including many of the towns and villages in the 2 counties, Nassau and Suffolk, that make up Long Island. That opt-out percentage I checked today is now at 42%. So a good number of those that opted out have since opted in. So that being said, welcome Gahrey and Hugo.
Thank you, Herb. Great to be here.
Thank you, Herb. Thank you.
All right, so let's start with a little recent news. On Tuesday, this past week, we had a town vote in Islip, and just tell us what happened.
Sure. So we've been working with the town for quite a few years now, right? Probably the last 2 years consecutive, speaking to council members, making them aware of all the benefits of legalizing and, opting into cannabis retail. Mm-hmm. When we started the conversation, there was 1 council member that was for it and 4 of them who were against it. And fast forward 2 years later, there are 3 that are for it and 1 that is on the fence and 1 that is absolutely opposed. So we've been making some progress and having some good conversations, and they felt that it was appropriate to maybe revisit their opt-out decision and maybe make some changes. So that brings us to April of this year, where they announced that they were going to revisit the conversation and propose some legislation and open up the conversation to the community to see what they wanted and what they thought of it. And from April all the way until Tuesday, where they were supposed to, on schedule, they were supposed to vote. We were having conversations with the board themselves, with the community stakeholders, answering questions, providing really good information, and just helping them to make the best decision possible. So ultimately, they decided to table the vote itself. And for those of you who don't know, that just means to postpone it, kicking that can down the road to a later date. They haven't given us the actual date just yet, but what they recognized is that clearly this was a conversation that the community wanted to have, that they were very passionate about, and they wanted to explore some more of that. In particular, the illicit shops that are open in the town of Islip, what they can do to start to close and minimize and reduce some of them. And then at some point in time, they'll put this back on schedule to vote. And in the meantime, we'll just keep showing up, providing good information and just being a voice of reason in the room.
And the arguments against, what were the...
They're absolutely ridiculous, Herb. So they're very much rooted in fear and ignorance and misinformation. So for those of us who are aware, Reefer Madness was a vilification campaign against cannabis throughout the 60s and 70s and 80s, and the war on drugs and all that other good stuff. There are people who are rooted in that, and they refuse to recognize that cannabis is no longer their grandmother and grandfather's cannabis, right? There are medical benefits to it. It's legal here in New York. It's business. And for those of us in the business space, we want access to it. And they're still stuck on the idea that, smoking cannabis or consuming cannabis turns people into monsters, and it's going to increase the crime, and it's going to devolve their communities into catastrophe. And ultimately, the problem there is that they were taking the conversation of the illicit market and applying it to the legal cannabis retail space. And therein lies the problem, right? They're taking problems from one area and overlapping and conflating it with another. And ultimately, once we started to share some information, we started to see that the people in the room, first time they had this meeting in April, there were, my goodness, hundreds of people there. The line was outside of the board meeting room, outside of the building, around the corner for everybody who wanted to be there and speak and just voice their opinion. By the time we showed up on Tuesday, it was less than one full room. And we imagine as we keep showing up and quelling their concerns and answering their issues and just providing that good information and feedback, there'll be less and less people until eventually the board members themselves will feel as though they're willing to vote. It's very much what we saw in Riverhead. When we first went out in Riverhead and they were proposing their new legislation, there was a room and a half full of people. And by the time, 6 or 7 meetings later, they were getting ready to vote, there was a single person in the room in opposition. Everybody else felt as though they voiced their opinion. We addressed them, they felt heard, and they didn't need to come back and keep saying this because they recognize that at the end of the day, this is a 21 and over legal industry. Right? And it serves that 21 and over community. And there's not a whole lot to say to that. They know that we're not putting in the hands with children. They know that we're not a criminal element in the community. They understand that this is enterprise. And America is nothing if not enterprise and free business, right? Free enterprise.
So now, Hugo, can you just tell us a little bit about the work of the Long Island Cannabis Coalition? In addition to the advocacy work, what else do you guys do?
We try to highlight and normalize cannabis on Long Island. So we try to do a lot of events, some educational, some just kind of having fun. Some are rooted just in collaboration with some of the dispensaries that are here in Long Island. And yeah, just kind of like putting just normalizing it, I think, just helping that situation because like some of the events that we do, for the most part, they're in high-end locations. So, you're in a wedding venue and stuff like that. So we try to keep it really high scale, as cannabis should be, right? Cannabis is like wine. It costs like wine, more than wine, what I'm saying? So I think it should be represented in that sense, and trying to normalize it. I think that's very important because people see cannabis as like the drug from the street or something like that, and which is totally not.
So Gahrey, Long Island has just under 3 million people. Town of Islip has about 300,000 people. How many dispensaries are there, licensed dispensaries, are there on Long Island, Nassau, and Suffolk? And do the folks in Islip think that the residents of Islip are not consuming cannabis at this point since they don't have licensed stores?
Yeah, no. So they certainly know that their constituents and their neighbors are absolutely consuming. They know it. They can smell it. Oftentimes in conversation, they support it. Right, at a personal level, they may not do it themselves, but they're not trying to get in the way of another adult, enjoying themselves. They recognize that it's very much like the alcohol conversation. Some people like it, some people don't, but it's your business as long as you're doing it responsible. Right. So that's how most people come to this conversation. Even the people who are in opposition in those rooms, we speak with them afterwards, and they're very normal, regular people. They recognize that we have every right and access, an ability to access this. They just want it done in a very responsible way. And I'm okay with that. I'm all for responsibility. I'm all for safety. And if things need to move a little bit slower so that the overall community can feel more comfortable with it, I'm okay with that as well. These things take time, and some people need a little bit more time than others. Here on Long Island, we have 7 dispensaries that are open, all in Suffolk County. And as you were mentioning earlier, all those opt-out towns. In Long Island, in the entirety of Nassau County opted out, and the vast majority of Suffolk County not opted out. There are 4 townships that actually opted in: Babylon, Brookhaven, Riverhead, Southampton. Of those, it's Babylon that they have 4. Riverhead has 2, and Brookhaven just opened their first one. So there goes that. Brookhaven and Southampton are probably the most difficult in terms of opening. And we're just looking to have more conversations with the municipal leaders there just to get them on board. Like, at the end of the day, you opted in, so sour grapes, if you didn't want it, it's too bad. You had the opportunity to opt out. You didn't, and now it's here. So you need to usher this thing in the most responsible way possible, and preferably the most sustainable way possible from a business perspective.
So in addition to or instead of the opt-out, what other barriers are entrepreneurs, facing on Long Island?
I guess that would be cash, right? The money, the money is lack of money is a big thing out here. I'll be an example of that right now. Right now, I was able to obtain a location. It has to go through variances. It has to go through still a whole bunch of issues. So it's gonna take time and money, and that's what I think a lot of us are lacking. In the beginning, it was we're gonna give you a turnkey store dispensary, and now it's like, you gotta obtain all this situation and find finance, get documentation.
Sorry to interrupt, but you
Mhm.
you have a license?
Correct. Yes.
Okay.
I'm part of the 150 to receive the license.
That was one of my questions. Just if you have a license and you're in a town, a municipality that it has opted in, what's the timeline from, getting that license to trying to open, getting open?
Yeah.
Mm.
So listen, take a look at Long Island, right? We have dozens of licensees out here, and 7 have been able to open up. And we're now 2 years into this game.
Yeah.
So on paper, they'll tell you it's about 6 to 9 to 12 months, from the time you submit your application to the time you can open your door. But because each township has their own unique set of restrictions and regulations on, that surpass what the state regulations and rules are, each one of those are just delayed with no specific timeline. And as they're moving through, just like one of our members in Southampton, as they're moving through, they've submitted. They've probably been in this in the municipal pipeline for, I'd say, 6 months or something like that. Just recently, they were rezoned outside of a cannabis zone, and now they have to start their process all over again. And that's what it's like. And here in Long Island, the municipal leadership keeps moving the goalpost of what it takes to open up your cannabis dispensary. And as such, everybody's just super hesitant. So money's one of those problems. Location, finding actual real estate where you can get it, because these, they have these little slivers of approved cannabis zones in each township. And in each one of those townships, the rules are totally different, right? So all of those are hardships. And this is where compliance, right? It's a wonderful word if everybody adheres to it. Compliance is a two-way street, not only for us as the licensees in order to open up the stores, but as well as for the municipalities to respect the rules of the state and give the licensees the ability to open their stores. And that's not what we're seeing at this point. We're still seeing the resistance, even from the towns that have opted in. Even in a place like Babylon that has allowed the most cannabis dispensaries on Long Island, we still see that they have rules in place that exceed the state regulations, and it makes it difficult to actually find a location and then open up. At the end of the day, here on Long Island, it's all about it's all about the courtroom. Eventually we have to get there, and it's just like in the normal course of business over my years in entrepreneurship, I've recognized that people only change through pain. It's only through pain that they actually create the change that they need to. And that's what the municipalities need to experience so that we can start to open the doors and they can start to be more in compliance.
What argument are you making to municipalities to try to get them to reconsider their position? Because they do seem to be getting sort of creative in and having these obstacles in your way?
Well, we start with compliance, right? First things first, because that's the one rule that rules us all, right? And we're all supposed to be in compliance. Just like I said, it's a two-way street. So we start there. I always recognize that this is Long Island and they're used to the idea of home rule, but in reality, they've opted in to this cannabis program. And as such, they need to be in
Yeah. And
compliance.
it's not actually opted in, right? The original,
They didn't opt out.
if you didn't opt out, you were in.
Yeah.
So they did not act in time.
Yeah. And in that way, they are part of this program.
Mhm.
And as such, it behooves them to be in compliance because it reduces some of the confusion that they have, the confusion that the licensees have, and when they get together about what they're allowed to do, what they can't do. And then ultimately just helping them recognize that it's not the big, bad, scary boogeyman that they think it is. Like I mentioned earlier, they still think along the mindsets of reefer madness and the war on drugs. And the problem is that this is our leadership. These are the leaders in our communities making decisions for us in our communities that are totally backwards and stuck in a very archaic mindset.
No, I saw some clips where people are still talking about cannabis being, the gateway drug.
Yeah. But, well, I mean, the gateway drug, they conflated it with prostitution. They conflated it with the sex slave trade. They conflated it with heroin overdose. Like all of these things, they just think it's all one and the same. They lump it together because they're still stuck in a very old mindset. What they are dinosaurs, right? And it's not until they're gone and extinct that we get a chance to move past and finally move into a space of acceptance and approval. In the meantime, though, while they're still here, we have to work with them and educate them and slowly bring them over from where they are. I'm not asking them to be proponents and fans of the industry, and I'm not asking them to consume, but I am asking them to realistically legislate this industry in their borders, which again, they didn't opt out, and as such, they are opted in. And because of that, there needs to be some kind of measure of reasonable approach to this conversation and the ability for licensees to open. 2 years later, there are 7 stores open in Suffolk County, and it's
I mean,
embarrassing.
some of those stores are the most highly revenue producing in the country because of the high relation and the lack of competition locally.
Yeah. And the other part is this is Long Island. Discretionary income, disposable income is a real thing. A lot bigger and different than a lot of places in New York and a lot of other places throughout the nation. There is money to be spent. There is a tremendous appetite. When each store opens up, it doesn't put a significant damper on the next store because there is so many people who are waiting for the convenience of a dispensary near them, and they just don't have it. So the stores that are opening, they have such a small sliver of the population that actually go and support them and buy from them, because all of these other locations, all of these other towns that haven't opted in, their communities are just waiting. They're going to their regular people. They're still not with the inconvenience of having to drive 30 minutes, 45 minutes, an hour to some other location. They'll just wait until a dispensary opens up near them because, again, the appetite is there and the discretionary disposable income is there.
And Hugo, you do have unlicensed shops that are open in Islip and in other towns, right?
Yeah, many of them, and we try to recognize them and let them know, like, like they're harm to the community. I myself have a few around my way, and I see kids going in them, and I'm like, how could we allow this and not, be a proponent of putting a real dispensary where we could have real sense of security for these kids. It's unbelievable.
And taxes being produced, right?
Yeah, I mean the money, yeah, 100% the money, but I'm more for the kids, like I feel more for the kids. I literally see them going to these smoke shops. It's crazy. It's just I don't know.
So, Gahrey, are there any policy reforms or support mechanisms that either from the state, the Office of Cannabis Management, from elected officials that you think might be of help in resolving this impasse?
Well, I think the recent guideline that just came out is a tremendous benefit, right? Tremendous help. It really starts to clarify what local municipalities are not allowed to do and the areas in which they are allowed to make some change or have some comment, right? That time, place, and manner, those 3 magic words. Out here on Long Island, they have absolutely used and abused those 3 words to create the most restrictive of cannabis deserts out here. That guideline really helps identify what they're allowed to do, what they can't do. And as such, I imagine that's going to be used by the licensees as a form of defense. This defends their positions to the locations that they have, to the ability to open up and their right to open up, as well as the ability to get these opinion advisory letters. That was also part of the guidelines that came out. Now there's a pathway for that to happen. And we've been communicating with the OCM for years as well. Speaking about these two particular issues, we need some clarification for the municipalities because they're just running rampant with their own ideas and concepts. So we need to clarify things for them. And then we need a pathway for that opinion advisory letter because those are the two things that provide us with ammunition to defend ourselves against some of these ridiculous notions of the town. Now that they're here, I imagine we're going to start to see more and more licensees use them in their defense. And I imagine it's going to start to get a lot more public and visible.
Are there not other industries or businesses that are siding with the cannabis industries? Like, for example, the real estate industry, right? If you have a storefront that's still open, you definitely would want to have a cannabis business.
Yeah, industry wide, no, I'm not seeing industry wide, the entire industries supporting. I am seeing individuals within multiple industries support. So restaurants and real estate. We speak with a lot of advocacy groups as well, right? Family advocacy groups. They recognize that even though they don't want this thing in the hands of children, they also recognize that the legal cannabis community is not putting it in the hands of children. They recognize that it's serving a 21 and older demographic. They recognize that that's totally fair and responsible. So we're finding responsible individuals within multiple industries and agencies. But at the end of the day, it's all about creating this larger coalition, right? It's businesses, it's community stakeholders, it's licensees, it's everybody that has to come together to kind of push this thing forward.
And now, in the towns that opted in originally, has there been any backlash? Do they regret allowing cannabis retail stores?
Babylon in particular, they're probably $4 to $5 million in tax revenue at this point, right? I haven't seen the latest numbers, but I know as of December, they were about 3.5, 3.8, something like that. So they've received a tremendous amount of tax benefit already, the most out of any of the other towns that have opted in. They're using that at their disposal and, for whatever projects that they want. They have reported 0 incidents of crime, nuisance, traffic, smell, any of those problems. And as such, when I speak to the supervisor there, he recognizes that originally he was one of those people on Long Island that absolutely did not want to hear. Is his council members and people around him that convinced him that, hey, this might be okay. And ultimately they did not opt out. He's recognizing now that that was probably one of the best decisions because not only is it a non-issue for them, all those concerns that they had, but they're making all of this money on top of that they're able to use in a bunch of ways that are germane to government as well as to a bunch of other tasks that have nothing to do with government. They could spend that money at their discretion, whatever they want to, and he finds benefit in that. A lot of the other supervisors have recognized that same point. There is money here to be made. We're missing out on this boat and we want a piece of that pie. But ultimately, we're just not seeing the actions line up with their words just yet.
All right. So what's next for the town of Islip and overall on Long Island? What do you see this going in the next 2, 3, 5 years?
Yeah, well, there's only one direction that it can go. Forward, and the second direction upward, right? At the end of the day, just like I mentioned at that last meeting, the cannabis baby is already here. There's no stuffing it back in. We have to be able to raise this industry responsibly and sustainably. And as such, we're going to see more and more dispensaries open. We're going to see towns, just like the town of Islip, have this conversation and ultimately vote yes to reverse their opt-out decision because they don't want to miss out on all of this money that their residents, their constituents are spending elsewhere. And in turn, they could be, keeping that money at home and to use for themselves. So I fully expect to see that. And I fully expect it to normalize, very much like the alcohol industry is, the tourism industry is. There's tremendous synergy amongst a lot of those industries with the cannabis industry, and we're just waiting for them to link up and line up so that they can kind of harmonize in a way that absolutely serves all of their communities.
All right. Well, and I'll ask you both, just to wrap up, like what message would you have, for Long Island residents that are uncertain, still have concerns about retail dispensaries in their communities? And I'll start with Hugo.
This would be that we have to educate ourselves to really know what we're dealing with, and I think we're lacking that. I think that we need to find resources and obviously look for LACC, because we're out there doing these education programs so people can really understand what the plant is, what the benefits are, and the non-benefits, right? And to understand too that we as an organization are out there to help, but also to gear and to guide people, right? To let them know, like, hey, this is good, but we also have limits, right? We don't want to see cannabis in these places, stuff like that. And obviously, it's just setting a normalization. That's what I think it is at the end of the day, and that's what we want to do.
The stigma issue.
The stigma issue, in a sense, but also too, just like it's making normal, like like being able to go, consume and not have people look at you weirdly and awkward, you know what I'm saying? So that there has to be some kind of like manner this could all go through, but just having those communications with the community, with the leaderships and stuff like that, I think we'll get to some of those points, and we'll be addressing those in the future as well.
Yeah, I think that's exactly right. It's definitely a matter of education. I think as I speak to people, I always remind them that it's going to be okay. Like, I- this is not as big of a deal as some people are making it, right? It's a sign of the times, is what it is. And what we have to do is move accordingly. Change is painful. It's also scary, but it has to happen. It's also inevitable. So we're at a moment of change in the cannabis space where it's now recognized and accepted socially. And even though Long Island is, its own little silo, if you look across the nation, there is overwhelming support for the cannabis industry, both medicinally and recreationally. And we're seeing that with more and more states approving it, more and more states legalizing it. And as such, we have to get on board as well. We might want to do it a little bit slower. We might want to do it with a little reservation or a little more education. And that's okay. We're here to support you in whatever way you need. If you need some help walking across that street, grab our arm. We'll help you go over there. And if you're ready to jog across on your own, that's okay too. But it's happening. So it's best that you learn to accept it, educate yourself around it. And if you need any kind of support with that, reach out to us. Let us know. We're here for you, whether you agree with it or whether you don't agree with it. We are here for you in every capacity.
All right, so where can people find out more about the Long Island Cannabis Coalition and support if they're interested in supporting the work that you're doing?
And that's great. And that's exactly where we try to drive everybody, right? So go to our website, longislandcc.org. You'll be able to access and find out more information about ourselves. We have a membership page as well. You can sign up and become a member. You'll receive our newsletter and all of the information that we send out about events and information and just things to know. It's free membership, which also makes it easy. We wanted to make sure that there was zero barriers access this information and be part of these communities. We have members in our space that are on Long Island, in the city, upstate New York, outside of New York. It's just about supporting the Long Island industry and their growth and ultimately acceptance. So if that sounds like something in your alley, please sign up. We'd love to hear from you.
All right, well, thank you, Gahrey and Hugo, President and Vice President of the Long Island Cannabis Coalition. Thank you.
Herb, thank you very much. Great to be here.
Appreciate it.
That's it for this episode of Joint Session Diverse Voices in New York State Cannabis. If you found today's discussion valuable, consider leaving a rating and review on your favorite podcast platform. It helps more listeners find the show. Better yet, share it with colleagues, advocates, and anyone interested in the future of cannabis in New York. Joint Session is produced by me, Herb Barbot, together with executive producer Robert Curtis from Simlev Media. Special thanks as always to Cannabis Wire. You can follow us on Instagram at jointsession.pod and on LinkedIn at Joint Session Podcast. If you have any comments, questions, or topic suggestions, reach out to me at herb.jointsession@gmail.com. Until next time, this is Herb Barbot. Thanks for listening.